So adopt NIST security standards, healthcare leader urges. This is from SC Magazine, from SC Media. And here we go. At a basic level, the healthcare sector is a human-focused business with highly advanced technologies and public expectations to drive innovation, often within stringent resources. Despite a tremendous amount of endpoints and advanced technologies, providers must protect themselves using the healthcare insurance HIPAA, essentially, the HIPAA rule. The trouble with the rule is it just has 42 controls compared to NIST, cybersecurity framework standard employed by a vast majority of other industries except in healthcare. NIST has all the controls that an entity might need to consider, and it's kept up to date as things change. As wireless came along, a new NIST guideline for each of these elements was produced. The rule stays relevant and current, explained Synergistic CEO Mac McMillan. HIPAA discussions began nearly 30 years ago in the 1980s. Draft rule emerged in 1993. He explained what finally came out of the Department of Health and Human Services in 2003 after 10 years of discussion was a watered down standard. The HIPAA security rule primarily focused on the controls necessary to achieve privacy because that is what HHS was focused on at the time. The original rule and requirements had just 42 elements compared with NIST, with 300 controls routinely reviewed by researchers. And while the sector has moved away from the checkbox compliance security method, HIPAA remains a bar for security measurements despite its shortcomings. He goes on to talk about how he's recommending that every healthcare organization adopt or even be forced to adopt the NIST framework. I assume you're in agreement with this. We adopted NIST back in, when I got there, 2012. We adopted the NIST framework, but of course we had no framework. I mean, I guess HIPAA was there, but it's not really a framework for security if I thought about it.
No, HIPAA, again, best intentions is HIPAA 30 years ago. And like Mac mentions in the article, it's privacy focused. If you go back to 2006, when I started in healthcare, everything was privacy driven. How do we handle data as it relates to the patient? Security was this kind of afterthought. The HIPAA security rule addressed security. Here was the interesting thing about HIPAA security when I got into it. Mind you, I was a NIST framework guy in the DoD, and I brought it with me in the other industries that I worked with. So I'm fully in favor of NIST as the standard. The HIPAA security rule had things that were required and some that were just recommended. So right there, if you think about security controls in general, how can you recommend a control like annual audits are required? Well, is that recommend? No, that's a requirement. These things should be requirements. And it hasn't changed. I think that's the big rub here, is that it had great intentions, but it never continued to grow with the changing landscape. Now, where NIST comes to bear is that it continuously changes. It's something that gets looked at on an annualized basis by the federal government. Now, I don't know if I agree with requiring it. Again, and this is one of those areas we've had this conversation before about a number of different things. Can you actually mandate some of those controls within the framework? I think your business determines what those controls should be and the level of that control that's implemented. And a perfect example is that if I'm reaching out into the community, maybe there's specific guidelines and controls that say I have to have X. Well, if that limits my ability to take a service and drop it into a patient's home, I can't have X, especially if my business model is at-home healthcare using technology. So there has to be a balance here. But I think as a framework, as a starting line, as the foundation for any program that's out there, this is the best starting point.